Hello, friends. It is so great to be here with all of you. Thank you so much, and happy Thursday to you. If you're joining me on the replay, happy replay day to you as well. We're live, and I'm excited to welcome you to today's very special live level up conversation.
Welcome to Level Up with Winnie Sun.
Hello, friends. I'm Winnie Sun, your host, Forbes contributor, CNBC Council member, and award-winning financial pro, here to keep you on top of relevant, trending business news. But more importantly, you're part of today's discussion. So we'll be sharing your audience feedback during our community moment. But today, I want to tell you, I'm very, very honored. A very, very special interview. This means a lot to me, so I'm really glad that you're here with me. I wanted to also welcome you back, of course, to the show. It's always great to have you join us. But today, let me just tease this before we get into it. He is Dean, National School of Tropical Medicine Professor, Department of Pediatrics, and the list goes on and on. But let me just tease a little bit. We're talking about a nominee for the Nobel Peace Prize, someone that I hope is on your radar. But before we jump to him, let's talk about how the market closed today. Unfortunately, I wish I had better news for you, but unfortunately, the market continues to struggle today. The Dow closed down 623 points. The Nasdaq closed down 407, and the S&P, unfortunately, also down 94 points. Really tough day on the financial markets. The Russia-Ukraine conflict continues to give havoc to the financial markets, and President Biden shared that the threat of Russia invading the Ukraine continues to remain very, very high. And of course, we have inflation concerns, and on top of that, we're still not finished with this pandemic. Now, on the economic front, weekly jobless claim numbers have come in at 248,000, rising from the previous week, and we were expecting 218,000. Unfortunately, still not what we hoped. Now, CNBC also reported something of interest today, and that is that the average household hasn't had time to make major changes to the way that they shop. So some news, it looks like although shoppers are still worried about inflation, it hasn't impacted the way that they're spending. News came out from the executives at Walmart saying that companies such as theirs are priced well and well positioned during this time. Now, without further ado, I want to introduce our esteemed guest. It is my honor and pleasure to introduce to you Dr. Peter Hotez. Now, many of you probably know him. He's a familiar face. He's been all over the news, all over national news. He's a scientist, pediatrician, leading advocate, and expert in the fields of global health, vaccines, neglected tropical diseases, and much more. He also serves as a founding dean of the Baylor College of Medicine, National School of Tropical Medicine. Thank you so much, Doctor, for being here. How are you today?
I'm good. It's good to see you, Winnie, and look forward to our chat today.
Well, I appreciate your time. I know everyone is very excited to hear from you, and we're honored to have you here today. I'd like to start with this, if you don't mind, Dr. Hotez, is to talk about your backstory, where you were, how you got here, because I think we'd like to learn about, your journey to this point.
Well, I'm from the Northeast, born in Hartford, Connecticut, and grew up in West Hartford, Connecticut, and had a lifelong ambition actually to study parasitic and tropical diseases. So I did my MD and PhD in New York at Rockefeller University and Weill Cornell Medical College, and that's been what I've been focusing on ever since, developing vaccines for poverty-related diseases using science for humanitarian pursuits. And we have new vaccines for schistosomiasis, a disease of 140 million people, mostly in the African continent, and hookworm infection, and a new Chagas disease vaccine. The coronavirus program is actually more recent. That's over the last 10 years. We started developing vaccines for SARS and MERS because they were orphaned as well. Remember the original SARS that came out of southern China in 2002 and spread into Toronto. And that's how we showed the spike protein as a target of the virus, how to deliver the spike protein. All that fed into the COVID-19 program. And now our center, which is called the Texas Children's Hospital Center for Vaccine Development, that's co-headed by myself and my science partner now for the last 20 years, Mary Elena Batazzi, has developed a low-cost COVID-19 vaccine for the world it's a vegan vaccine that uses yeast fermentation, similar to what's used to make the recombinant hepatitis B vaccine. And the reason why that's relevant is because that technology for making hepatitis B vaccine is in place in India, Indonesia, Bangladesh, Vietnam, China, of course, Brazil, and multiple other countries. So that if you want to make a COVID vaccine for the world, this one you could plug and play pretty easily. And now this one has been, when we've licensed it to 4 developing country vaccine manufacturers, they actually call themselves that, the Developing Country Vaccine Manufacturers Network. We've licensed it to, with no patents, no strings attached, to Biological E in India, to Biopharma in Indonesia, and SEPTA in Bangladesh, and Immunity Bio, which is building infrastructure in Botswana. India is the furthest along. They're producing 1 billion doses, so that's really excited. It's been released through emergency use authorization in adults and now teenagers, 12 and up, and soon kids, and trying to build infrastructure along the way. So we're working furiously to close that vaccine equity gap, because that's the reason why we're seeing all these terrible variants emerge, like Delta out of India last year and Omicron out of Southern Africa. Until we vaccinate the whole world, we'll continue to be buffeted by these variants. And so aside from the obvious humanitarian need for these vaccines, is the fact that it's in our own enlightened self-interest here in the United States.
Mhm. Absolutely. Well,
That's the
thank you
Cliff
so
Notes
much.
version.
That's a Cliff Notes version. I'll take it. Well, it's interesting that you've been saying, you said, well, we've been working on this COVID vaccine. It's relatively new. And you said we've been working on it for the last 10 years. I think many people who are not in your field thinking, wow, that actually been studying this quite a lot longer than it was on our radar. So let's talk about this a little bit. Obviously, it's a highly controversial topic. Um, but you've been such a vocal person about you're already so busy working on helping people all over the world. How do you have time to then share this with the public, and why is this important to you?
Well, for the last 20 years, I've always tried to maintain a foot firmly planted in public engagement. And that's the hard part of my life, is being a working scientist and keeping up with what working scientists do, and keeping up with the grants and the papers, and keeping up with the scientific literature and in the lab meetings and all of that sort of thing. But also trying to really address public concerns about science, and most recently to combat a pretty aggressive anti-vaccine movement. So I have 4 adult kids, including Rachel, who has autism and intellectual disabilities. And a few years back, I wrote a book with the straightforward title, Vaccines Did Not Cause Rachel's Autism, because that was the original assertion from the anti-vaccine lobby. And the book, is an important book, because it not only tells about having a daughter with autism and intellectual disabilities, but also what autism is and how it begins in early fetal brain development through the action of autism genes, and why it's not related to vaccines, and the evidence is not related to vaccines. And because that was the original assertion of the anti-vaccine lobby, they made the false claim that vaccines cause autism. I went up against it in a big way, and it paid the price in the sense that I became a public enemy number 1 or 2 from the anti-vaccine groups. In fact, they call my nickname, according to one of their Instagram sites, is the OG villain, the original gangster villain, for doing that. So Winnie, you're having the original gangster villain on today. And it hasn't stopped. I mean, in this time of COVID, the anti-vaccine lobby has grown in size and organization. They have political action committees. They have a lot of political money. They've now linked themselves to political extremism on the far right. You see, the Proud Boys at anti-vaccine rallies in Washington, and I'm targeted accordingly. And so they, a couple of weeks ago, they went after me on 2 successive nights on Fox News, the Fox News anchors, and that's been a problem. And I've had far-right members of Congress go after me on podcasts. So it's a very scary place, because when they do something like that, it's followed by a wave of aggression, a wave of threats, and they know I'm Jewish, so a lot of it is filled with Nazi symbols and that sort of thing. And so I've had to bring in Houston Police Department and Anti-Defamation League. It's as I sometimes say, it's a tough time to be a scientist in America.
It's a tough time to be a scientist, indeed. It and I applaud you for doing what you do. I know it's not easy to do. I think, as a parent of young children, I think sometimes we feel like we want to be in control and have the knowledge and feel comfortable, right? This is something that we're all living through for the first time. And oftentimes as parents, we're thinking, is vaccination the right thing to do? And I think I've thought that as a parent. I know many people still feel this way. A lot of people still feel like a lot of this was rushed, right? And so thank you for speaking out on that. I think that uncertainty certainly is something that we can relate to. There's a lot of fear and concern of things you don't understand, but hopefully with your help and that science we'll get more comfortable with this. So let me ask you this.
Well, let me just say to that
Mhm.
point, Winnie. I mean, I think this has become more than an academic discussion because since last summer, 200,000 unvaccinated Americans have lost their lives to COVID, despite the widespread availability of vaccines since last May. So 200,000 people have, in a sense, thrown their lives away because of whatever this is, allegiance to the anti-vaccine lobby and aggression, especially on the far right. In fact, the New York Times, David Leonhardt in the New York Times, has called it red COVID because it's such an obvious partisan divide. And that's the other part that's really hard to talk about, because as a physician scientist, your training says you're not supposed to talk about Republicans and Democrats and liberals or conservatives. But I haven't found a way to talk about it without talking about it. And it's not that I'm politicizing vaccines; those guys are. And what I'm trying to say is this anti-science, anti-vaccine sentiments and aggression doesn't belong. I try to uncouple the two, but it's been really tough.
It's been really
And it's taken on a lot of violent language and threats in the last year, and still going.
So you went through this with your daughter with autism and the concern about vaccines. Did this surprise you, just how strongly this became a discussion of anti-vaxxers versus those who followed science? Did any of this surprise you?
I think the part that I didn't count on. I mean, it started out, as small groups, mom and pop groups concerned about autism or concerned about something they've read on the internet. That part I understood, and I thought I knew how to talk to parents about that. And generally, I had good success talking to parents, and eventually they'd vaccinate their kids. I think the kind of the twist that it took starting around the 2010s, though, is when it became a political movement, and they started forming political action committees, and there was a lot of money from the Republican Tea Party for this. And at first it didn't make any sense. Now I'm starting to understand it. And so that by going up against these political action committees, you were fighting something much bigger than you ever dreamed. And in response, they began not only targeting the science, but you see this on Fox News at night. Now they're targeting the scientists, and even portraying you prominent U.S. scientists like myself and others as enemies of the state in a very sort of old Soviet communist fashion from the 1930s, something out of Stalin. And that worries me if this continues to accelerate, because as I like to say, this is a nation founded on our research institutes and universities. It's what allowed us to help defeat fascism in World War II and win the Cold War, and help in the control of HIV/AIDS. And so we are a nation of science and innovation. So to see that under threat gives me a lot of pause for concern.
Well, let me ask you this, Dr. Hotez. I'm going to circle back a little bit. And so, do you think there is a way that we can have a more comfortable discussion about vaccines, and to be able to have these, conversations where some of the heat can be turned down, and we can finally get to a point where you talked about the importance of having global vaccination. Do you see this as something that can be changed, or do you feel like I don't even know where to begin?
Well, I keep trying. I think working on something called neglected diseases my whole life. By definition, I'm an optimist, and so any chance, anytime despite what they do to go after me, anytime I'm invited on Fox News, I go on, or any of the conservative news outlets, or I'll do a Breitbart interview, and always willing to talk to conservative groups, because I think we have to do it to save lives. Again, 200,000 unvaccinated Americans losing their lives needlessly. I don't even know what you call that anymore. It's not even misinformation or disinformation. It's some form of self-immolation, and it's a killer. So I'm working on a new book now that has the working title "Anti-Science Kills," that really highlights this and tries to educate people how far the anti-vaccine, anti-science movement has become. And then the question is, what do you do about it? And part of the answer is, I'm not sure I know what to do about it anymore, because it's gone way beyond the health sector when this has become a political movement. So I've recommended to the Biden administration that they look at trying to bring in some experts outside the health sector to get educated on what we can do, from whether it's from Homeland Security or the Justice Department or the Commerce Department, to understand what our options are to combat the aggression and to save lives. I think the other piece to this, relevant to today's news, is we know the Russian government and Putin's propaganda machine has been using this as a wedge issue to divide our country, to expand the gap between Republicans and Democrats, and through this very sophisticated program of what's sometimes called weaponized health communication with bots and trolls. So this means bringing in the State Department on this. So there's a lot of things we need to do.
There's a lot of things we need to do. Well, let me circle back real quick. I want to ask you, Dr. Hotez, why a patent-free vaccine? Why did you decide to go this route?
Well, as I like to say, when your house is on fire and you can make one phone call, you don't call the patent attorney, you call the fire department. So we're the fire department, and I just saw, so much global vaccine inequalities in the fact that the African continent is, for all practical purposes, remains unvaccinated. Much of Southeast Asia, the poorer countries of Central America and tropical regions of South America, unvaccinated. We've got to fix this. And so I said, look, let's just take the patents off the table, and we'll worry about it later. Let's get this vaccine out to people. And I think it's resonated. I think people are really happy to see this. I think they're getting tired of all the fighting and worrying about intellectual property when so many lives are being lost, especially in low and middle income countries. And the fact that until we fix this, we're going to continue to have this pandemic until we halt the variants of concern from emerging from unvaccinated populations in low and middle income countries. The only tough part of this is it's very idealistic in nature. It's necessary, it's essential, but it means that we do depend on private philanthropy for this. We really don't get any money from the U.S. government. We got a little bit, about $400,000 from the NIH early in 2020. That's about it. So it's really nothing compared to the billions people are getting, companies are getting, and nothing from the G7 countries. So we struggle. Fortunately, some private philanthropies in New York, like the JPB Foundation, or in Texas, some of the Texas philanthropies like Tito's Vodka of all organizations, and the Clayburgh Foundation, Dunn Foundation, MD Anderson Foundation. That's one of the reasons we came to Texas, because it is a good philanthropic environment, but we're still, we still struggle because we, like any other organization, we have to pay the salaries of our scientists, and that's always the tough part. So I'm amazed we've gotten as far as we have with our group of 20 scientists, but I think we could go faster and quicker with additional support. And as I said, no one else seems to have this mission of vaccinating the world like we do.
Okay. And so for those who are listening and who want to help, I know that this is an area where they can go and contribute. They can make donations. Where should they go to do that?
Well, if you're on Twitter at all, pinned to the top of my Twitter handle is a donation page for our Texas Children's Hospital Center for Vaccine Development. That's one way, or you can contact me by email. It's pretty easy to find. The anti-vaxxers seem to have no trouble finding it, so I'm sure your listeners won't have much trouble finding it either. And
Right,
that's right. That's where the top of the Twitter handle is.
right on the
Um,
top of the
so,
Twitter.
and that would really help. And even small donations make a difference. Because and by the way, our vaccine looks like it'll be the lowest cost of all the vaccines. So simple technology made locally. In India, it's being priced at 145 rupees a dose, which I had to look up. That means about $1.90 a dose. So it's the least expensive of all the COVID vaccines. And now Indonesia's producing a similar version of it. And because it's vegan, it's actually, they're going to make it as a halal version for Muslim
Wow.
majority countries. So that's exciting as well. And now in Botswana, it's looking really promising as well in Bangladesh. But we're getting calls from countries all over the world. So
Mhm.
Vietnam, for instance, has the ability to make hepatitis B vaccine a similar technology, so they could make it. Or countries in North Africa, or even other countries in sub-Saharan Africa or Latin America. So
I would
we still keep pushing.
keep pushing. Well, thank you for pushing that. And I think because you said this is like old technology, so I imagine it's easier to replicate, and it's probably technology more people around the world are comfortable, right? Because it's
That's
something
right. That's
they're
right. In fact,
familiar with.
we've actually done something also kind of unique. It's open source in the sense that we've published every step of how we make the vaccine. And you can just download the papers if you go to the PubMed, National Library of Medicine search site. We have 5 papers where you don't even actually even have to talk to us to make it. Although we make it easier for you to do that because we'll provide the starter kit or the production cell bank, and we'll help in the assay development and help you in the technology transfer at our own expense. But again, we just decided we're going to make this as easy breezy as we possibly can do this.
Wow, that's incredible. Well, let me ask you this. COVID appears to be more manageable right now, right? We're hearing good numbers even this week. Of course, it's still here, but it seems like there's a bit of optimism across the country. What do you see next? Anything we should start to be prepared for?
That's a great question. So you're right. The numbers are coming down, especially in places like Maryland or Eastern Maryland, where it's now getting down below 10 new cases per 100,000, which is good news. New York and New Jersey, it's coming down. And so what I've been saying, that this will allow some type of national reset to us to really take a hard look at where we're heading with this pandemic. And a few thoughts on that. I think the hard part is going to be getting ready for another wave, because I don't think we're done. And so trying to get the American people to understand that even though this is finally looking really good, it's not final. I'm anticipating another wave across the southern part of the United States and Texas, just like we saw in 2020 and 2021. How do you get the American people ready for that? Should we create some kind of coded alert system? The governor of California just announced some new measures now. He's not calling it a reset, but he's saying getting ready for the endemic phase. I'm not sure I'm thrilled with that word. It's not quite right, but I understand what he means. And so I think the governor of California is sort of the tip of the spear in trying to get the people of California ready for the next step. I think we could be in for regular winter waves. So that's going to be the hard part, is making people understand that we're still in for not sort of a long-term low level of infection, as some are saying, but it'll appear in waves just like it has the last 2 years. And so getting ready for that next wave. And by the way, we could still have another bump through the BA2 variant, although it's looking like so far it's not happening. It's not impossible, so that's something else to consider as well. But I think the time points that I'm worried about are over the summer in the southern states, just like we've had in the last 2 years, and then a peak in the winter, and maybe that'll go on for a few years, winter peak. So one of my colleagues, Mark Lipsitch, who's a professor at Harvard School of Public Health, early on in the pandemic, I think he was right. That we could see these winter peaks, and maybe Omicron was the first example of that, and I think that's a possibility as well.
as well. Well, thank you so much for sharing that. I when I went to visit Taiwan actually right before the big pandemic hit here in the United States, and I remember even going on the subway system and seeing people already mask up and knowing that, well, if you're maybe not feeling so good or things aren't feeling as safe, then go ahead and mask up. Do you think that that's a smart strategy for us as parents? We have children going to school. Is that going to be sort of a long term strategy? Like, I know there's a lot of talk of whether or not masks should be still maintained at school. I'm here in California, so I think a lot of parents are still feeling a lot of anxiety of what we should do.
Yeah, I mean, I've done a lot of work in China and Asia over the years, and when you go, especially in the winter, you see that the mask culture is for real. A lot of people do wear masks, pre-pandemic, and so it's better accepted. It's never a bad idea, right? I mean, we know now the benefits of wearing a mask are that it also helps prevent other respiratory infections. I think it's a reason why we've had such mild influenza seasons the last 2 years. So certainly nothing wrong with that. But I think, and it depends where you are geographically. So here, where I am in Texas, right now you go into the stores and, pretty in restaurants, pretty much nobody has a mask on, unfortunately. So, it's just not part of it's just not reinforced by many of our elected leaders. So I think that's always going to be tough, trying to convince people to re-implement masks or mask mandates if we do have those new waves.
Okay. Well, thank you. Well, and lastly, I know we need to let you go, but I just want to say congratulations on the recent Nobel Peace Prize nomination. Just before you go, tell us, how did it feel to be recognized with this nomination?
I was pleasantly shocked, and I felt this kind of wave of relief. Not relief's not quite, but an elation not quite right either. It was this a feeling of validation because I've been so aggressively attacked over the last 20 years, but it's accelerated so much in the last 2 years. So I guess the word I would use is this feeling of validation that that what I've been doing is valued by the world in terms of making vaccines for the world's poor and making this low-cost COVID vaccines and fighting the anti-science aggression. So there was a lot of emotional release. I was a bit in tears actually when I learned about it. I have no idea what the likelihood is that I'd ever get something like that, but just the recognition of that a group would think enough of me to nominate me. In this case, I think it was Congresswoman Lizzie Fletcher from Texas, who's an amazing person. Was just a really special moment for me and for my family.
How do your kids feel? They must have thought that was pretty cool.
Well, you know how adult kids are, or maybe you don't know, but they're too cool for school, as they say. But they were great. They were very supportive, and
Well,
even my special needs daughter, who has a lot of intellectual disabilities, understood it and gave me a hug. That was really nice.
aw.
And I told her, "Well, Rach, you helped me get." Her name's Rachel. I call her Rach. You helped me get there, Rachel.
Well, we are so proud of you. I'm very excited for you. And so, congratulations for your achievement. And thank you for all that you're doing for not just here in the United States, but across the globe. Um, so keep your spirits high. We certainly appreciate your time. And we know you are so busy. So, in interest of time, I'm going to go ahead and close this off a little early. And thank you so many of you for coming in. I see you live. I see the positive comments. And Dr. Hotez, lots of love for you today. So, um, with that, I guess we will call it a day and I'll see you again next week. Take care, everybody. Thank you so much, Dr. Hotez.
Thank you, Winnie. All the best.
Thank you.